Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Okay, this is Healthy Living Tuesday, and we are joined once again by the guru of everything medicinal, Dr. Jitka Lom from Express Care. Of course, we're very, very happy to have you here because we're talking about PMS, something that I could not even begin to answer because I'm just a guy. So we do have several questions about PMS. First one comes from Chalampago, and this comes from Kate, Dr. Lom. And Kate says, what is premenstrual dysphoric disorder? I think you touched on this earlier and everything, but if you can go into a little bit more.
That's the one we were just talking about, where women will sometimes have much more emotional and behavioral difficulty during the 2 weeks before their period begins, and that tends to be more of a psychiatric and emotional disorder that they need to have treated, where it's not just sort of like not feeling well for a few days. It's extreme.
Okay. Question number 2 comes from Chrissy from Mingilao, and Dr. Lom. Chrissy asks, are there any specific medical tests that can diagnose PMS? Now maybe she's asking, can you pinpoint it and see specific days in the calendar? I know most women kind of, they either know already or they're aware of it.
The main way you diagnose it is make sure that nothing else is going on, that the person doesn't have a thyroid problem or anemia or another psychiatric problem such as severe anxiety or real depression. But the main hallmark of PMS or PMDD is that during the first 2 weeks of the cycle, the woman's perfectly fine. There's nothing wrong at all. She feels great. And then passing the middle part of the cycle, the other symptoms will come. And then this is cyclical and repetitive and goes on and on and on every month very predictably. So that's how you tell. There are some hormonal assessments that can be done, and sometimes those are a little bit helpful as well.
Okay, good word. Question number 3 does not have a person that addressed it, and this person asks, anonymously, Dr. Lom, what food should you eat and or avoid to prevent PMS?
Yeah, well, trying not to give in to the cravings would be important. The chocolate, the chips, the salty food would be important to avoid. Avoiding binge eating, trying to exercise, trying to get a good night's sleep, drink lots of water. Fruits and vegetables are very important. You can take a supplement called vitamin B6 up to about 100 milligrams per day. That helps also. And taking calcium and magnesium is very helpful as a supplement all month long, but especially during those 2 weeks. Those would be sort of the lifestyle advice that you can take.
All right. Barragata has our next question, and this comes from Norma L. And Dr. Lom, Norma asks, does cutting out coffee lessen the stress of PMS?
It will for most people. Coffee tends to raise the level of your circulating catecholamines. Those are your stress hormones, and you're already stressed out, so don't add more. Because of the caffeine? Yeah, because of caffeine. So cutting back during that time would be helpful for most women. Okay, do you recommend for like heavy coffee drinkers just to do decaf just for the placebo effect? Or? Just go back to decaf. Even decaf has a little caffeine in it, but less. Okay. Yeah.
All right, and our last question, anonymously once again, but Dr. Lom, this person asks, can all medication be purchased over the counter, or can something stronger be prescribed?
You can get a prescription for medicine to help you during that time of the cycle. Sometimes just being on birth control pills can help women to regulate their cycle and have a more even hormonal picture. Other times medicines such as antidepressants can help, or anti-anxiety medicine can help. Those would be sort of the main things that we would prescribe for them.
Okay, well, thank you so much for your insight. Once again, we can't wait until the next week's topic.
Thank you.
All right, and speaking of topics, make sure to go to KUAM.com/Facebook. That is our Facebook fan page. We will be posting the topic, and you can ask the good doctor. This and other questions relative to medicine, we'll use your questions next week, so tune in for that. Health Check is up next. We're back after this.